Picture this. Somewhere in rural Nigeria, a child is getting a malaria vaccine, while scientists around the world are racing to outsmart a parasite that's been deadly for centuries. Could this moment be a turning point?
It's May 13th, 2025. Let's dive in. Malaria has long been a leading cause of child deaths, especially in sub-Saharan Africa. But with 2 vaccines now recommended by the WHO, we're seeing a shift. 19 African countries have already started giving these vaccines as part of childhood immunizations. That's quite a leap, isn't it?
It really is, and the momentum's building. At least 30 countries are aiming to add these vaccines to their national programs. Let's look at the 2 vaccines, RTS-S01, which you might hear called Mosquirix, and then the newer R21 Matrix M. RTS-S was first, who recommended it in 2021. R21 Matrix M got pre-qualified late in 2023. Do you think those differences matter much for rolling them out?
That's a good point. RTS-SAS01 has already made a dent, reducing child deaths and severe malaria hospital visits. But the supply can't meet demand, and that's where R21 Matrix M steps in. It's less expensive and can be made in larger quantities. Would you say that helps address gaps for countries with fewer resources?
Definitely. Both vaccines need several doses in early childhood, but the schedules aren't always the same from country to country. The real advance here is that with 2 vaccines, there's finally enough supply to meet the need, especially since malaria is still claiming the life of almost 1 child every minute in some places.
The numbers really stand out. In areas using RTS-S, there's been a 13% drop in overall child deaths and 22% fewer severe malaria hospitalizations. That's tens of thousands of children every year. But supply isn't the only challenge. What about reaching kids in remote or underserved areas?
That's where it gets tricky. There are real hurdles, health systems that aren't robust, not enough cold storage, staff shortages, or even just the realities of distance and tough terrain. To tackle this, governments are teaming up with groups like the OPT-MVAC Consortium. They're sharing strategies, optimizing how vaccines get delivered, securing funding from Gavi, and getting technical advice from WHO and UNICEF. Building trust at community level is also crucial. Without it, uptake stalls.
So it's not only about sending out vaccines, it's about improving whole health systems. What's on the horizon? Are there other vaccines in the pipeline that could change things further?
Yes, there are some promising candidates. One is the blood stage Rh5.1 Matrix M vaccine. It targets malaria after it's left the liver and entered the blood. In a phase 2b trial, it showed 55% effectiveness over 6 months, which is higher than what we've seen so far. Then there's the PFS-PZ LARC2 vaccine, which could offer strong protection with just a single dose. Early trials are starting this year in the US, Germany, and Burkina Faso.
A single dose. That could make a huge difference. No need for families to keep coming back or for health workers to manage multiple appointments. Could that kind of vaccine help us get closer to the WHO's target of 90% protection against Plasmodium falciparum?
That's the big question. So far, no vaccine has reached that 90% target. But researchers think that combining vaccines that attack different stages of the parasite's life cycle could get us closer. And the ripple effects would be enormous. Last year, there were 263 million malaria cases and almost 600,000 deaths, most of them young children.
Still, there are real obstacles. Climate change, drug resistance, new mosquito variants, any of these could undermine progress. And reaching every community will require steady funding and cooperation. 8 more countries are set to introduce these vaccines in 2025, and 13 have support to expand their programs. Is the global community prepared to keep moving forward?
It needs to be. The advances so far show what's possible when science and international partnerships come together. We're not at eradication yet, but it's closer than before. the fight against malaria really does show what coordinated global health efforts can achieve.
From new vaccine rollouts to ongoing research, the malaria story is evolving quickly. Thanks for joining us as we explored how science, policy, and collaboration are reshaping the fight against this disease.
Stay curious, keep asking questions, and thanks for listening. The goal of a malaria-free world feels within reach.